Well, good afternoon, everybody. My name is Ruth Das. I'm the Partnership and Engagement Lead for the Embrace Multicultural Mental Health Project. I'm really glad to welcome you to today's webinar on behalf of the Embrace team. It's great. We've had such a great response to today's webinar, so we're really hoping that we can share some practical tips with you on delivering safe, quality and culturally responsive services. Before we start, I'd just like to go through some housekeeping matters. First of all, today's webinar is being recorded and the recording will be made available on our website in the coming weeks. Participant chat today is disabled, but we are welcoming people to ask questions, and you can do that through the Q&A function, which is at the bottom right-hand corner of your screen. And you can also submit questions anytime through the webinar. And if you would like to vote for a particular question, you can do that through the Q&A function. You will also receive a link to a feedback survey at the end of the webinar, so I really encourage you to fill that out. It really helps us refine our webinars going forward and helps us know what else you'd like to have in the future. The purpose of today's webinar is to provide you an overview of the Embrace framework for mental health in Multicultural Australia, and particularly we're drilling down and focusing on module number 2, which is delivering safe, quality and culturally responsive services. And we'll also be providing some community and clinical case studies. And I'll be presenting the first half, and then we'll be joined by a special guest, Maria Cassaniti, who's the Centre Manager of the Transcultural Mental Health Centre in New South Wales. So I'd like to acknowledge the traditional owners and the First Nations people as the traditional owners of the country throughout Australia and their continuing connection to land, sea and community. I'd also like to pay our respects to them and their cultures and to all elders, both past and present, and express our support to voice, treaty and truth-telling. I'd also like to recognise the unique contribution of people with lived experience of mental ill health and those who love and care for them in championing mental health reform. At Embrace, we celebrate people of all backgrounds, genders, sexualities, cultures, bodies and abilities. So as I mentioned, today is a really great opportunity for us to talk about the framework for mental health in Multicultural Australia and to particularly focus on module 2 of the framework. And we're going to go through what that framework module looks like and some of the principles that are integrated into that module. And then we'll be providing specific case studies from the community and from clinical practice. This webinar is really designed for Australian mental health services, practitioners and people from primary health networks. If you are from a community multicultural organisation, you are welcome, of course, to join us, but keep in mind that the focus for today is on mental health service delivery. So why is cultural responsiveness important for mental health services? And in terms of setting the context for today's discussion, I thought it would be really good just to think about and reflect on why we're here and what motivates us in this work. We know that we are a very diverse nation and Australia is very multicultural. We know that over 51% of us were either born overseas or have a parent who was. We also know that people from multicultural backgrounds have reduced access to services, including mental health services, but they don't necessarily have reduced needs. We also know there are particular nuances around safety and quality and risk and protective factors for people from migrant and refugee communities, and that's why it's especially important for us to give consideration to those factors. And we also are really aware that refugees and asylum seekers are at greater risk of developing mental health problems and suicidal behaviours than the general population. So why is that important for us working in mental health services? Accessing support and information about mental health is for everyone in the community, and so we need to make sure that our services reflect that. Stigma, cultural meanings and barriers to discussing mental health and illness have different meanings in different communities. And often our mental health support services take a particularly Western biomedical approach or a model that might not always be appropriate for people from migrant and refugee backgrounds. And so our services need to be flexible and culturally responsive. So in just thinking on that, what changes do we want to see in our services? Oops, sorry. Having a little issue here, thank you. We want to see services that are responsive, adaptive and tailored. We also want to see migrant and refugee community attitudes and beliefs that embrace positive mental health and help seeking. We definitely want to see reduced stigma around mental health in migrant and refugee communities. And also we want to see positive mental health and wellbeing outcomes amongst migrant and refugee communities. So just what does that look like? The principles that we want to include are, of course, trauma-informed care that is co-designed, that is collaborative and shares power. We want to see services that are person-centred, not service-centred. We want to see services that are culturally informed and evidence-based. We want our mental health services to have flexible engagement processes with people from migrant and refugee backgrounds. We want to see services that have really proactive outreach and a whole of organisation approach to change. So as a result of all those factors, the Commonwealth Department of Health set aside some funding for the Embrace Multicultural Mental Health Project a number of years ago. And so I'm going to spend the next couple of minutes giving a brief overview of what the project entails. So as I said, the Embrace project is funded by the Australian Government Department of Health and Aged Care. We provide a national focus on mental health and suicide prevention for culturally and linguistically diverse communities. We help to improve the cultural responsiveness of mental health services and the mental health workforce. And we also aim to increase mental health awareness, literacy and capacity in CALD communities. And so in order to achieve all of those aims, we have a number of different activities in the project, and the framework is one of those key activities. The Embrace website, which you might have seen, is a hub of information, resources, translated materials, best practice examples, policies and case studies to support services and multicultural communities. And that's where the framework for mental health in Multicultural Australia is housed. And the website has two main arms. One is directed at community, multicultural and migrant communities, and the second arm is for service providers and mental health services. So they're the two main arms you'll see on the left and the right-hand side. One is for community, and it entails and captures personal stories, multilingual information, brief information about mental health services and community organisations. And then on the right-hand side is information for mental health service providers, including, as I mentioned, the framework and other best practice guides there. Some of the resources that we have on our website are a number of videos from our lived experience group and a number of translated fact sheets on mental health issues. The project has two really strong focuses that can be summarised in these two main aims. The first one is to strengthen the cultural responsiveness of mental health services, and secondly, to strengthen the mental health of multicultural communities. So in that regard, we have redeveloped and refined the framework for mental health in Multicultural Australia. And that's the main tool that we use for services, and we recommend to services to help you assess and gauge and ascertain where your service might be in terms of cultural responsiveness and how you might like to build on your strengths, and also identify areas for opportunities for building your cultural responsiveness and develop an action plan to do that. And so the framework is the real pillar of the Embrace project, and that's the main tool that we encourage you to have a look at and use. So the framework is free, it's nationally available, and it's available online. It supports mental health services, practitioners, primary health networks, and others to work more effectively in a multicultural context. It consists of a set of tailored modules and self-reflection tools. It's mapped against national standards and transferable across different contexts, and it's very useful if you need to undertake accreditation processes. You can use the framework to do that. And it's self-paced, and it also provides you access to free resources. So why we need the framework is that it really helps us turn those principles that we've talked about earlier into strategies, into actions, and develop really detailed strategies that are tangible and have great outcomes for our communities. It's a process, as I mentioned, for assessing our capability. It helps us to make measurable improvements, and we can track that progress over time, and it's a really great quality improvement tool. So the framework is made up of 4 modules, 4 core modules, and today we're going to focus on number 2, which is around developing safe, quality, and culturally responsive services. But the other modules also give you really great skills and tools that you can use in developing strategies and planning and working together to promote mental health, and also building a culturally responsive mental health workforce. So you can access the framework on our website. You're free to use the QR code, and I believe my colleague Aruj has put the link to the framework in the Q&A section. And so please feel free to go and have a look at that while we're talking today or after today's session. And as I said, this is what module 2 will look like when you come up to this particular module. So in terms of culture and developing culturally responsive services, we know that all of us have bring to our identity culture, and culture is really the lens through which we see the world, in which we understand the world. It's the way in which we do things, the pattern of our behaviour, and it shapes every part of our lives. And we all belong to different cultures. We all have belong to different cultural groups through our family, where we live, through our beliefs, through our conduct. And culture can operate on many different levels. Culture can also change over time, and we can move in and out of different cultures. And people aren't always aware of the impact of their own culture on their own behaviour and daily living. Culture can be seen as a pattern of automatic assumptions that we unconsciously hold, and sometimes we can take our culture for granted. Everyone, as I said, belongs to different cultures, and developing cultural competence or cultural responsiveness is a lifelong journey. And when we talk about cultural competence, what we're really talking about is awareness, knowledge, skills and practices and processes that we bring with us in order to function effectively in our society. And it's the way we interact with people that our culture will manifest itself. And culture can manifest in different ways of thinking, communicating, and doing things. And having cultural competence really is the heart of cultural competence is respect for each other, for people who have different cultural backgrounds to ours. As I said, culture can affect all of our behaviour. And when people come to access our mental health service, they bring their whole self with them, including their culture. And so for us to learn how to respond in a way that meets people with their cultural where their culture is really important. So in terms of the framework and how that looks at cultural responsiveness, there are a couple of really key principles that underpin this work. And the first one is that we want to ensure that everyone in the community can get the support when they need it. And that principle of equitable access is absolutely critical to this work. The framework assists mental health services to identify and address access and equity barriers, along with ongoing commitment of successive governments in the past across Australian jurisdictions who all work together towards an inclusive multicultural Australia. So under these principles, there are a number of key indicators that we have set out that help you map or guide you in your thinking about whether you're providing an equitable service. The first one of these is around language services practices. So this means that a service will have consistent implementation of a language service policy, and people from multicultural backgrounds are aware of their right to access professional interpreting services, and importantly, that children and family members aren't used as interpreters. So what this looks like, for an example of having a great language service practice, is a mental health service that has a language service policy which clearly describes the processes of booking a face-to-face or a phone interpreter, and it has posters in a waiting room advertising interpreter services, and that when a person sees someone from their service, they're given a appointment reminder translation tool, an appointment reminder from the New South Wales Department of Health, for example, that reminds them when their next appointment is in their own language. So that's an illustration of what a great language service practice looks like. It's also really important when we're thinking about equitable access to think about how your service promotes itself. And does it do that by disseminating information in English and other languages, using appropriate methods that might be useful to those particular communities that you're targeting? And does the promotion that you engage in take into consideration where people meet, for example, in community places of worship or schools or libraries? And is there information available at your service in those places? So a really great example of that would be a service that advertises its services in a library or a multicultural resource centre and has posters and leaflets and available at those centres to promote the service. The third indicator of an equitable accessible service is the outreach that the service looks at and has in place. So a really great outreach practice will mean that a service has considered and implemented outreach mental health services where appropriate and responsive to local community needs. So a great example of this might be that community mental health service regularly attends an interagency meeting to promote their service and let support services know how they can make referrals. And someone from that particular mental health service might visit the local mosque on a Friday and invite the imam to the service and show them to have a look at the office and the services that are available. So really proactive outreach is a really good indicator of a service that promotes equity to access. The fourth indicator of equitable access is rights and responsibilities. And this is when we talk about people who use the service from multicultural backgrounds are informed of their rights and responsibilities using their preferred language where necessary. And a great example of this might be that a service might provide a short video about rights and responsibilities in particular languages that can be shown to people in the waiting room while they're waiting to be seen. Service navigation is really important as well. And in terms of service navigation, we mean that the service provides a culturally safe and welcoming environment where practitioners have sufficient time and flexibility to build trust and rapport with consumers and carers. So again, as you go through the framework, there'll be some indicators of how you might be measuring up to this particular standard. And those indicators might mark you as being at the pre-entry level where you have no flexibility for the needs of cold consumers in relation to their navigating services, right through to advanced where you have several flexible service delivery options that are tailored to the needs of community members. So for an example of a service that demonstrates good service navigation is where the service provides longer appointments so that interpreters and bicultural peer workers can be used in treatment sessions. A really equitable service also incorporates the cultural needs of people who use the service. So that would mean that the service has developed policies and practices that facilitate the accommodation of specific cultural-based needs in amongst its cold consumers. carers and families, such as childcare needs, dietary needs, religious needs and observations. So again, a really concrete example of this might be a mental health service that has extended opening hours 2 evenings a week and also provides access to a prayer room. So the next aspect of developing safe, quality and culturally responsive services is through a principle that we call service delivery, and we really flesh out in this particular part of the framework what safe, quality and culturally responsive services look like. So this particular part of the framework gives you key considerations to translate good intentions into good practice and provides really practical steps on how to do that. So the first thing we look at in this module, under the key indicators, is assessment processes. And so in order for a service to provide culturally safe, quality and responsive services, a service will ensure that assessments of people from multicultural backgrounds are delivered in a culturally responsive way. And some of the key considerations amongst those is that there's enough time given to build trust and rapport during the assessment, that practitioners are responsive to different explanatory models of mental health and illness, that assessment instruments or inventories administered with consumers and carers are culturally appropriate and where feasible, culturally validated, and that cultural, religious and community family supports are explored as potential protective factors in the context of a holistic strength-based assessment. So another example of this particular indicator is that during a consultation of an adult man presented who had recently migrated from the Democratic Republic of Congo, and the mental health practitioner, as part of their initial assessment, asked this man how his mental health was viewed in their country of origin. The client shared that their religious beliefs in his home country were prominent and that mental illness was viewed usually as a demonic possession. So this exploration and conversation allowed the therapist to explore these beliefs and how they might affect his care. In terms of treatment and support, again, we want to make sure that a culturally responsive service includes services that are person-centered, recovery-oriented, aware of intersectionality, strength-based and collaborative. And so that's really important in that particular way that treatment and support, that cultural responsive services are delivered in a way that's tailored. And then lastly, we want to make sure that services provide coordinated care that's tailored to someone's cultural needs. So in terms of handover, referral and discharge processes are inclusive of family and community supports that are available and ensure that those are culturally relevant. So for an example, a child has been referred to you for an assessment from their school after they've displayed repeated behavioural outbursts in class time. After seeing the family for 6 weeks, you refer them to a specialist trauma family service for ongoing care, and you connect them to a service that has bicultural workers that share the family's cultural background and language. So you can see that all of these particular indicators and principles have really practical steps that you can follow to make sure that you're meeting the cultural needs of your clients and their families and carers, and that cultural needs are integrated into the care. So I'm now going to hand over, before I do that, I just wanted to add that as part of the module that we've gone through, module number 2, there are a number of resources that you can access. And so when you go into this module, you'll see on the right-hand side this list of links that provide you particular resources related to this module. So I'm going to show you, this is a summary of all the resources that you can have a look at in your own time. And some of them are really practical, such as this one, which focuses on culturally responsive clinical practice working with people from migrant and refugees. That's been developed by the Migrant and Refugee Women's Health Partnership. The Transcultural Mental Health Centre in New South Wales also has a number of mental health assessment tools, particularly this one that is the K10, which is translated into 35 different languages. That might be something you'd like to have a look at and use. And there's also another one of the resources that we have on the website is the Refugee Health Practice Guide, which again goes through lots of different resources and tips working in a culturally responsive way. So there's a plethora of resources available in this module that will give you some really good guidance on how to provide culturally responsive mental health services. So I'm going to stop my presentation there, and I'm going to hand over to Maria Cassaniti from the Transcultural Mental Health Service. We're really, really glad that Maria's been able to join us today, and Maria's going to walk us through some case studies from the New South Wales Transcultural Mental Health Service. Thanks, Maria.
And thank you very much for that warm introduction, Ruth, and for your ongoing collaboration and for Embrace's collaboration with Transcultural Mental Health, which is key to how we work and how we advance this important space for our state and from your perspective and from where you work for the nation. So the Transcultural Mental Health Centre in New South Wales has been around for quite some time and has for many years worked closely with the Embrace project as well. Now, to add to what Ruth has presented, it's important that culturally and linguistically responsive services are seen and we plan for them well, because they are vital for effective mental health care. We know that the experience and expression of mental health are mediated through the filter of culture and by exposure to new cultures. And such experiences guide how we perceive and describe illness and how we participate in treatment. And that is at the heart of why a centre like the Transcultural Mental Health Centre is important in New South Wales. New South Wales, so the Transcultural Mental Health Centre contributes to a New South Wales health response. It doesn't stand alone. It works very closely and collaboratively within New South Wales Health, including public health planning and service provision, in which the primary goal is to improve the mental health and wellbeing of populations. We work in partnership with mental health services to support and supplement their work with our culturally and linguistically diverse populations across the lifespan and across the multitude of migration and/or refugee experiences. We also work in partnership with our community service providers and multicultural agencies to support their work in building community capacity in mental health and wellbeing and in mental ill health prevention, early intervention and pathways to care. I might ask Ruth or the Embrace team to move to the next slide. Thank you. So as you can see from the screen, the Transcultural Mental Health Services and programs are multi-pronged, and as outlined by the image on the screen, our work is focused on supporting mental health planning and policy inclusion strategies and their implementation, research, education and training, community engagement, increasing mental health literacy, multilingual resource development, right through to the statewide provision of clinical consultation services. So many of the items that Ruth explained as part of the framework, they are the pieces of work that we do. Now, the key principles guiding the work include a strong commitment to equity in care and understanding that communities benefit from a combination of wider societal mental health campaigns, as well as target initiatives which are culturally and contextually responsive to the specific needs of a community. Acknowledgement of the importance of specialist supplementary support for individuals from CALD backgrounds and including carers and families, recognition of the value of working in clinical care partnership with mental health services to enhance culturally and responsive care, education and information, and acknowledgement that individuals with a lived experience of mental ill health, their families and carers often benefit from a combination of cross-cultural as well as cultural concordant transcultural mental health care. Now, for the purposes of today's presentation, I will expand on the centre's clinical components of care. Now, next slide, please. Thank you. The centre provides our clinical services by two streams. Our clinical components of care are delivered by in-house bilingual clinical staff and also supported by bilingual sessional clinicians. One stream is focused on primary level support through the Transcultural Mental Health line. And with this service, it connects with community members to clinicians who understand their culture and can communicate in their languages. So it connects community members to clinicians that we have on staff. The line is set up to reach and provide a direct service to consumers and enhance pathways to mental health information and care. This service provides brief over-the-phone and telephone support for callers, including support for carers and family members of a person with a mental health concern. The line also provides information for callers on how to access mental health care and connects them to relevant service that suits their needs. Now, to provide information to communities out there about the line, we at the outset of setting up this service, we produced resources in 42 languages about the line, including postcards, multi-language posters for waiting rooms and notice boards, and also social media tiles. And over time, we've also worked out that different communities like to get that information differently. The resources themselves explain that for callers who don't speak English or have limited English proficiency, they can call the National Translating Interpreting Service to be connected to the line. Alternatively, the carers and family members and friends or service providers can assist the consumer with the consent by phoning the line on their behalf, and from there the team will set up the call to speak to the person directly. Next slide, please. Now, the second stream includes our clinical consultation service, which is a secondary tertiary level service, and it works in partnership with New South Wales Mental Health Services to supplement and support the provision of culturally responsive mental health care and enhance access to and delivery of quality mental health services. So it's a secondary tertiary level service, and clients do need to be connected to a public mental health service to receive a service from this part of our clinical component of care. The model itself is based on the premise that the client is actively connected with a local hospital or community mental health service. Therefore, the TMHC clinician provides specialist parallel input as requested by the local team, together with the client, carer, and family. The consultation service includes advice and time-limited clinical intervention, culturally responsive psychosocial assessments, and care recommendations. Cultural information to clarify diagnosis to support the treating team is also provided, and mental health literacy support, both with the client and the individual, and the family and carers as well as required. The service also responds to requests from our New South Wales Health Refugee service for clients who present with mental health concerns when they first come into the country and into our state. And the Transcultural Mental Health Centre also supports other units of New South Wales Health with information and cultural advice as well, and including community managed organisations, GPs and PHN. So while we don't provide direct clinical services to their clients, we still provide them with information and cultural advice as they request. Now, in addition, the multicultural mental health outcome and assessment tools developed by the Transcultural Mental Health Centre and New South Wales Health assist healthcare professionals to provide culturally appropriate care. The tools include a transcultural assessment checklist, a transcultural assessment module, and a transcultural referral guide. And the guide is the image on the screen at the moment. The link to these resources I'll add to the chat after I finish speaking. Now, if we can move to the next slide, please. Let's now look at a person's journey and how our service works in putting the framework principles into practice. So let's look at that and what it looks like in any one day or week for the Transcultural Mental Health Centre. A person who has recently arrived in Australia and calls the Transcultural Mental Health Line. They found out about the Transcultural Mental Health Line through a translated postcard they picked up at a community event, where a Transcultural Mental Health staff member presented in language about mental health and wellbeing and how to connect and how to contact the line. When the caller calls, they have limited English skills and they speak with a clinician who also speaks English and other languages, but doesn't speak their language at the time of the call. So it doesn't speak the language of the person who's making the call. So when the team are unable to cover the language spoken by the caller, they can readily connect with the local healthcare interpreter service that we have here at base, or the National Translating and Interpreter Service to support service provision. Importantly, the line has an account set up with both interpreter services, and that makes for easy, seamless access as required. The Transcultural Mental Health Line then provides the caller with culturally responsive over-the-phone support via the assistance of an interpreter and relevant information. The caller is also connected to a local support service. Next slide. Now, a few weeks later, a worker from the same social support service calls the Transcultural Mental Health Centre to seek advice about how to better support that particular individual. At the same time, they seek support of how to support other individuals from migrant and refugee backgrounds that often drop into their service. The team has downloaded translated materials available via the centre's website. They've also downloaded materials from the Embrace website. However, the team at the time are of the view that their team would benefit from tailored training to build capacity and enhance their team's engagement with communities experiencing mental health stressors related to migration and particularly refugee experiences. The team at this point requests training from Transcultural Mental Health on cultural awareness, cultural competency and working with interpreters. The Team HC is able to deliver that training to suit the team's service provision requirements, and at the same time they add in the information about the framework. So when the team is ready, they can also work through the framework at their own pace. Next slide, please. Now we go back to the person's journey. Now, 6 months later, as the anniversary of the invasion of Ukraine approaches, the person attending the social support service who has lost family members and friends as a result of the war is expressing increasing distress about their inability to return to their homeland. Their mental health at this point starts to spiral down and deteriorate. The social support service encourages the person to contact the Transcultural Mental Health Line again, and also provides contact details for extended hours support lines. The person ends up in emergency unit despite all those numbers being provided. They're very distressed at this point and express suicidal ideation. Now, following care at the emergency unit, and as part of the discharge plan, the person is referred to the local community mental health service this time. The Community Mental Health Service contacts the Transcultural Mental Health Centre. They are made aware that the person is already aware of our centre and they would like the community centre to call. This time around, the team and the client are connected with the clinical consultation service, so the stream 2 of the clinical component of care service. With the client's consent, the community team requests support with a transcultural mental health assessment, culturally responsive short-term counselling and information on options for longer-term psychological support services. And from here, the Community Mental Health Service links the person with a local general practitioner. Relevant cultural information that the Transcultural Mental Health Centre has nicely packaged up for the team is also shared with the general practitioner, The general practitioner then works with the individual on a mental health plan, including access to psychological support as agreed to by the individual. Now, this person's journey is one of many different journeys. And this example illustrates how our centre's multi-pronged model of work enables the framework principles to be evidently put into practice. And on that note, I hand back to you, Ruth, as we move into the Q&A time. Thank you.
Thanks, Maria. We now have I think, an opportunity to ask questions. And I think Maria's given us some really good indicators of what this work looks like in practice and how we can be involved in this work on a day-to-day basis. So I'd just remind you that if you would like to ask a question or you'd like to vote for a particular question, please use the Q&A function at the bottom right-hand corner of your screen. And I'm going to now hand over to my colleague Aruj, who's going to read out some of the questions.
Thanks, Ruth. We've actually got quite a few questions, which is great. So the first one is, does the framework include information and guidelines on how to work effectively with interpreters, since a great majority of culturally and linguistically diverse persons rely on their service?
Sure, I'll answer that question. Yes, absolutely. The framework does provide guidelines around using interpreters. And in particular, you'll see, as I mentioned, there are links to a number of different interpreter policies around the country and recommendations for best practice there. So if you don't have an interpreter service policy and you're starting from scratch, you can go and look at those particular examples that are on the website and draw from those the principles that are needed for a really good interpreter service. Thanks.
That's good. We have another question relating to interpreters. So someone's asked, does the framework recommend engaging NAATI credentialed interpreters, and how to check the credentials of each interpreter provided by labour hire companies? Or should services be happy with bilinguals without credentials, provided this very specialised field of interpreting?
I'm happy to go first if you like, Ruth.
Thanks, Maria. Yeah,
that'd
be great.
The view there is that the TIS, or the National Translating and Interpreting Service, would employ people with credentialing, and certainly in New South Wales, our healthcare interpreter services provide definitely engage and employ people with the credentialing. Importantly, for areas where you do have the benefit of your own local healthcare interpreter services, it is also the next step of really good transcultural practice is to have interpreters trained in working in mental health as well. So that training for interpreters to work in health and in mental health adds that next layer. But of course, if you are in an area where you can only access the translating and interpreting service, the national one, which we're very glad to have in this country, then it's just important that you brief and work with the interpreter and brief them about what you're about to go into, and that will also assist a clinical situation.
Thanks, Maria. I'd like to just add that, yes, Embrace does absolutely support using accredited NAATI interpreters, particularly in working in mental health, because some of the terminology can be very technical, and it's really important to use a trained interpreter. And also trained interpreters and NAATI accredited interpreters will also abide by a code of conduct, which ensures confidentiality, which is really important to people that we work with. So we definitely do advocate for using NAATI interpreters who are accredited.
Yep, I think we have a question from Maria. So a few people have asked, is the Transcultural Mental Health line available for callers from other states in Australia?
No, at this point, it is a New South Wales health funded line that's been funded a few years ago now. and it is for New South Wales only. We have had a few calls that have come in from interstate, and of course we will help with information where those calls come in, but it is a New South Wales dedicated line.
Brilliant. There are other services in other states, particularly people experiencing anxiety or distress over recent events overseas. There is the hotline, Witness to War hotline, that people can access, which is a national helpline that can be accessed as well, and that's through the National Torture and Trauma Services.
That's true. We have another question. Someone's asked if Module 2 can apply to non-mental health services too. They're thinking about this in respect to GPs and maternal and child health nurses trying to improve immunization rates.
That's a great question, and we often get asked this question. Yes, the framework was designed for mental health services, but it is totally transferable to other health services, and we have found that people have picked it up and used it quite effectively within other services. So while it is designed for mental health services, yes, it is transferable.
Someone has also asked in the question, which is, do you have any suggestions for culturally appropriate assessments?
Maria?
For culturally, I'm having an issue with adding information to the chat, but the multicultural MOAT tools certainly will take you through like how to explore that kind of explanatory model, what to explore in the assessment, time of migration, family context. So part of it is what you would do in a ordinary assessment, but it adds those points around the additional questions and prompts to look for in families or for an individual that that has recently migrated or has been here quite some time. So a lot of those cultural questions are added into the tools and are very helpful.
And I'll just add that in the Embrace website, as I mentioned, there are links to different culturally developed assessment tools, such as the Translated K10 that's available through the Transcultural Mental Health Centre. There are links on the Embrace webpage through the framework to different tools as well. But you can also have a look at not only our website, but the New South Wales Transcultural Mental Health Centre's website, but Queensland and Victoria's Transcultural Mental Health Services websites also have some really great resources in terms of culturally tailored assessment tools.
Thanks. So someone's asked are there specific barriers that CALD youth face when it comes to mental health, and is there a way universities can be more involved in advocating for culturally appropriate mental health services?
From my perspective, go Ruth.
Yeah, no, absolutely, you go first.
From my perspective, I mean, with depending on the training that you're doing, embedding training and developing clinicians and practitioners and mental health professionals for working in a multicultural space is essential. And we often are a bit behind the 8 ball with that, because we understand what needs to be done, but often training takes a bit of time for it to catch up. And I guess that's why training, this kind of very tailored training, is so important when people hit or are in services. So regardless, for university, there's so much that universities can do in terms of, in this country, in terms of research particularly. So that kind of translating their work into practice and vice versa, and working with services and people on the ground. And I know various universities are doing their utmost to get that work happening, but we really need people to stand up and really be interested in this kind of work and research unfolding, because that's where we're going to do a lot of learning and change or change, not change practice, but add to our practice improvement.
And I think I'll just add, Maria, that I think for young people, there are particular issues that are relevant. A lot of young people particularly face racism and discrimination in schools, and also conflicts within generations between transitioning from different cultures to the Australian culture. It can often present conflict between young people and their parents or older people within their family. And I think in terms of universities, there's definitely support that universities provide through student support centres and counselling services that are accessible to all students, including international students. But I will just note that it is sometimes difficult for international students to access Australian mental health services because there are issues around insurance, private health insurance, and sometimes those services aren't always accessible. So it is really important that we reach out to international students and young people, particularly as we know that they are particularly vulnerable.
And so for people that are in the country, not international students, but families that migrate here, we need to get in. Sorry, I misunderstood the question before because I can't see it in front of me, but we need to get into really that early intervention in schools is so important, because often families migrate here with the best of intention for themselves, but particularly for their children. So once families actually understand that the migration journey and the loss and grief often that comes with it, and some of the challenges that come with migration, once they realise some of those challenges are that their young person or their child is also going through those challenges, but at a different pace, in a different environment, it's about engaging families and parents to understand that the child themselves, just because they speak English or are able to access the English language and learn the English language at a faster pace, it doesn't mean they don't have their own migration experience. Families don't know what they don't know. If we don't actually talk about these migration experiences and much more openly in schools, that's where we will make a difference and not get unstuck and not push these issues downstream. So that's really important.
Maria, we've got one more question. So someone's asked, how does the framework embed and ensure that LGBTQ+ called folk are able to access services that are safe and affirming?
That's a great question, and definitely the framework is designed to have an intersectional approach and to ensure that the needs of all clients and all their needs are met in a way that's responsive to their own needs. So the framework definitely encourages people to assess the person that in their whole self that comes to the service with all those needs and all those challenges, and not just look at cultural diversity, but also look at other issues as well. There are resources throughout the framework that support intersectionality as well. So we definitely advocate for all services to really comprehensively provide holistic care.
I think we have time for another question. So someone's asked, how do you satisfy the requirement for privacy or consent if interpreters are required for a consultation, and still provide some background to the interpreter prior to the consult?
Yep. So as I mentioned before, all professional accredited interpreters do have to comply with a code of conduct, and that includes confidentiality. So any information that you provide to an interpreter in a briefing prior to a consultation, they need to keep confidential and not share that to anyone else. So that pre-briefing is included in the code of conduct and that confidentiality agreement.
And importantly, often with our clients, we just have to, really stress that. So, speaking about consent to some doesn't make sense. Like it's just doesn't, it's not a concept that makes sense in many communities. So, unpacking that for what you know, it may mean for them, and exploring it and those repeated messages as well to reassure them, and understanding often that trust may take time to build. It may not happen in 1 or 2 sessions. It may take a number of sessions before that trust is even entered into. So there's all those factors that come into play as well.
And also being really cognizant of the fact that lots of people's trust has been broken before coming to Australia, and their trust in government service is, you know, quite fragile, and they are reluctant to trust government services with good reason. So that's an added imperative for us to make sure that we really communicate that confidentiality is really important, and it's absolutely well regarded in Australia and will be respected.
And another point that links to that, is not just about consent, is we also have to remember that people come from parts of the world where mental health stigma is so big. But apart from that, mental health services in other countries are non-existent in the way that we understand them. And some, you know, I mean, there are archaic systems still in place when someone is unwell with a mental illness in some parts of the world. So that's the fear that people often bring into our services, and that has to be navigated through and understood as well.
So I think we're running a bit short on time, but I can see we have quite a few more questions. So I will be noting these questions down, and we can look into ways to respond to everyone. Thank you so much for sharing your questions. I'll hand back over to you, Ruth.
Thank you, Aruj. So just like to finish today's session by letting you know that, and reminding you that there are lots of resources available through the Embrace project, including some of those resources that are up on the screen, more information about the Embrace project and about the framework. We also have webinars that have been recorded on our website that you can access at any time, and we have user guides to the framework. We will be running more workshops this year, so keep an eye out for information about additional workshops, and they will be advertised through our newsletter, which you can also subscribe to through the website. You can feel free to contact the Embrace project at any time as well. If there's any particular questions you have, or if there's any way we can support your service, please let us know. We would, as we mentioned at the beginning, appreciate your feedback via a quick 5-minute survey to improve future webinars. So please complete the survey through the QR code that is on the screen now. We really appreciate any comments that you have in order to make these webinars more useful to the sort of information that you need to support your clients. So on behalf of the Embrace team, I'd really like to thank you all for your continued commitment to supporting people from migrant and refugee backgrounds in providing culturally supportive and responsive services in mental health. I'd particularly like to thank Maria Cassaniti today for her wonderful words of wisdom and experience in guiding us through some practical applications to the framework. I'd also like to thank Aruj Hanifi for her support in the question session, and the Embrace team. And I look forward to hearing from you and joining you again in another webinar. So thank you very much for your time today, and have a great rest of the day. Thank you.
Thank you.
Everyone.